Hi, good evening, and welcome to Innovative Dentistry. Again, tonight we're coming to you live from TBN Studios right here in Queenstown, Georgetown, Guyana. And tonight we have a special program for you, and we will be continuing from where we left off last week, but it will be dealing with something totally different. So tonight, Dr. Pico is in the studio, and we're going to be talking about something that if what we did the last time didn't work, this is the next line for you to do this. Again, we want to welcome you to Innovative Dentistry. We're coming live from TBN Studios right here in Georgetown, and we do this every Wednesday at 6:30, and we're here again to bring you some very informative pieces of information that you will need as it relates to care of your teeth. Dr. Pico, welcome.
Hello, sir.
How has been your week, man?
So far, so good. What about
Wonderful,
yours?
wonderful. Well, it's been busy here in the studios. We've been doing a lot, and it's like everything else. We get to move on with things. We don't wait back for anything nothing holds us back here, you know.
Same by my side.
Yeah, and how was
nothing is holding me back.
right? You got to move forward, you know. On a lighter note, in life there are always I've read this the other day. It said there's never failure. There's only feedback.
Mm-hmm.
And when I read that, I said, this really makes a lot of sense. If you consider everything as not failure, but feedback, then you will learn from everything that is considered by many people as failure.
Mm-hmm.
And, you know, being a new businessman in a country that you've just been here for under 10 years, yeah?
7 years.
7 years now. So, you doing what you're doing is really commendable, and
I feel so happy that I made the decision to start by my own. I am so happy, extremely happy.
right, fantastic.
Yeah.
And you know, Dr. Pico, we always advocate that when we talk about dentistry and oral hygiene and dental care and all that, it's usually we always say that it has to be something that you don't have to go to innovative dentistry to get treatment or to get consultations or whatever the case may be.
Mm-hmm.
Because we understand that oral hygiene it should be a human thing worldwide. Everybody should be taking care of their teeth, because you need your teeth for, you know, if you're going to want to enjoy life and have a bright smile and enjoy good food and all of that, then you should be taking care of what is in your mouth.
Mm-hmm.
And so what we advocate for is that you, wherever you're living, if you're living out of Georgetown, you're living in the rivering areas, there are health centers set up in your area. They can do lots of care for you there, and you should go to those places, whichever private hospital, wherever you want to go, just do that.
Yes. So we are in a free country. You are free to go in whatever place you decide to go.
Yeah.
So.
And I totally agree with you. So one of the things that we dealt with last week, what we dealt with last week was crowns. Mm-hmm. And we spoke about zirconia crowns and all of that, and that was amazing, because it goes to show that if you have a damaged tooth and, you know, the extent of the cavity is not as great as it is,
the feeling
not so bad that
the feeling is not working.
Yeah,
and then
that's right.
it's
Yeah,
falling off all the time. The tooth is too fractured. Still, you can save the tooth by doing a crown if you have a root canal done, or if it's not, a crown can save a single tooth, because the primary objective here is to keep what the nature gives you.
Mm-hmm.
So we don't advise to take out teeth just like that. You have to keep what the nature gives you, because that came with you, and that will give you a good service during your whole life. So, however, if what the nature gives you has some failure, some big cavities, it's impossible to save the tooth, and the extraction has to be done, then we have also a solution for those that lost one single tooth, multiple missing teeth. we have solution for all of that too. So that is the topic that we are starting today.
Great.
Sorry that I'm doing your job.
No.
But last week you want to steal my job.
Exactly. You know, you got me thinking right now, because last week I remember I started telling you about dentistry, and today you take over the show, and you're like, I'm thinking, well, hold on, this man got a vendetta. You know, like you want to, but that's a good thing. You know, in Guyana here, you could have a single tooth in your mouth, and we said teeth, you know.
Oh yes. I have that experience learning Creole. How people are coming to my office saying I have my teeth hurts.
Uh-huh.
And when I went to check, I see one single tooth. I said, what?
So the person got one tooth only.
One tooth. Yeah.
And they said the teeth hurting.
Yeah. I got confused because I was looking for teeth.
Yeah. And also we say, you know, in some places we don't say toothbrush, we say teeth brush.
Toothbrush. Mm-hmm.
I don't know if you've ever heard that.
Yeah. Mm.
Tonight's topic is implants.
Dental implants.
Dental implants. And dental implants would be the next step if you have a failure in a crown, or the extent of the cavity or fracture or general damage to a tooth is beyond that of a crown, then the next step will be implants, dental implants.
That can be an option. We have multiple options to recover one missing tooth.
Okay.
So, like for example, if you miss one tooth and you don't want to, we can do a bridge. That, as we spoke in the last show, a bridge is a set of crowns joined together, in which you are using at least two teeth to replace one missing tooth. So we can do that. We can make a bridge to replace one missing tooth. But the problem with the bridge is that the bridge, for us, the dentist, to build up a bridge, we need to file down the two teeth that are next to the missing tooth area. And if the extension of the missing teeth is too much, meaning that you have more than one, sometimes if you file two teeth only will not be enough. We will need to extend the bridge, so we will make sure that the retention is not compromised. So the problem is that once you're doing a bridge, you are filing your natural teeth. Some of those teeth are mostly all the time intact. There is no damage. So actually we are filing something that is not don't has any damage.
Okay.
Sometimes that it has a little filling or a big filling, and we are solving a problem, preventing that filling in future will not fall, because will be part of a bridge under the crown that is holding the whole structure. But it's hard for some patients or even for dentists to go and file down teeth that are
Healthy.
It's really hard. So in that
Scenario.
we have a next option, which is the dental implants. So I know that maybe our audience, they know already what is a dental implant, or some of them just they have an idea, or maybe a little bit part of the population don't know what is a dental implant, but mostly everybody knows what is a dental implant. And dental implants are tooth or root-shaped screws that are made with a special material. The special material is the titanium. Recently, zirconia is taking over. As I explained, zirconia is the latest type of material that is dominating the dentistry right now, because of how biocompatible is the zirconia. We will talk about that later. But as I say, the dental implants are root-shaped screws, basically. That I don't know if we can see this image on the screen.
So we have an image up here
about what dental implants are. Yes, as the audience can see here, there are different type of shape, but however, the common shape is like a root. It's like a root with some spiral
Threads.
threads.
Yeah, yeah.
That this will make sure that the implant can screw into the bone. Okay, and it has a part which is the root-like part. This area here, and also on the top we can see a platform. That platform has an internal screw, which is to screw in.
Okay, so you have internal threads.
Internal threads, yes, exactly. Internal threads to screw in an abutment, which is something that is also part. We can see here, for the audience to have an idea, the implant is on bottom, the abutment is on the top, and this abutment is the part that will be holding the crown.
Okay.
Okay, so we have when we are ready to do the rehabilitation of this dental implant, we have two options, or more than two options. We have the option to screw in the crown or cement that crown over this abutment here.
Okay.
Okay, and the story of the dental implants, how this start, is coming from 1952, in which a doctor, an orthopedics, Dr. Brannemar from South Africa, he started to use titanium, placing the titanium on rabbit's bone, and later on he continued with that. So Brannemar is the father of the implantology, the science, and later on in 1965, the implants became worldwide known as a treatment that was allowing the dentist to rehabilitate the missing tooth. In 1965, I guess that the patient received one implant on the lower jaw.
Okay.
And the implant didn't fail, and the implant started to be a popular type of treatment that become more popular in this century. Something that we can say about this is a little bit expensive. It's young. It's a little bit expensive. Okay, it's still expensive because also the technology is developing every year. The technology is developing. The implants are made with titanium, which is a biocompatible material. So what this means that the body will not reject the material.
Right.
Mostly, all the time, the body will keep the body. When I say body, is about the bone, because this is going into the bone. The titanium will stimulate the bone cells to grow around the threads, keeping the implant in the bone through a process that the name is osseointegration. Okay, so once this process is completed, then the implant is ready to load to receive a crown over. We will talk a little more about that during this show, because there are some particular situations that the patient has to know. Not everybody can get a dental implant, or some patients will need some type of extra treatments to get these dental implants.
I have a question. When I can't say this for sure because I haven't been in that position of having any metal in my body or anything like that, but I've heard that people say when they have fractures of the bone or anything like that, they have a broken arm or really bad fractures or broken bones. There are times when that bone has some sort of a steel inside there for them to, for it. It may not have been titanium in the past, but I've heard people say that when it gets cold, this metal inside the body becomes cold and all of that. I don't know. As I said, I've never been there. Do people with implants, titanium implants, do they have that do you hear of such a concern? And I'm asking this question because I'm asking this question for the public. If they have this thought in their head and this question in their head, then I would like for that to be dealt with.
The implants the dental implants specifically are not exposed outside.
Okay.
The dental implants remain inside of the bone. So there is no way for any coldness or anything like that to reach into that inside for the person to feel any coldness. There is some kind of popular stories about if outside is lightning or something like that.
Yeah,
something will
yeah, yeah,
happen. No. It's
It's not gonna happen.
It's not like that.
And these are the myths that we have to put aside. And it might sound crazy to ask these questions, but these are the questions that will come to you because there are myths out there about, yes, as you rightly said, lightning. If you got a implant in your mouth and lightning strike, it may hit you in your jaw and you may
Exactly.
die and all of that.
Yes.
Yeah. So
Nothing like that will happen. No.
okay, great. Dr. Pico has some images that he sent to me today that we're going to be looking at in this show. I just a little bit of an advice that some of the images has blood, and it's with a tooth being removed, and it's a little bloody in some cases. So I would just like to advise that if you cannot deal with images like that, then we'll let you know when those images are coming up. You can probably look away or because I'm a bit like that too,
Yes, and
I'm a bit like that. I really can't deal with,
some people are sensitive.
right. So if you're sensitive to such images, we're gonna let you know when those images are coming up, and please take precautions not to look at them if you can't. Yeah.
Exactly. Yes. So about the indication of the dental implants, it is something important. The dental implants, of course, as we said at the beginning, are indicated once the person is missing a tooth and the person is willing to receive back a tooth without damaging the rest of the teeth. Or if the person is missing more than one tooth, it's possible to replace those missing teeth by using multiple dental implants. So this means that we can use one single implant or more than one single implant depending on the condition. There are some also another type of indications, like the implants will be elements to retain dentures, for example. Also, you can have a denture, a total denture, meaning you are missing all your teeth in your mouth, and you don't have enough bone in your mouth to replace the whole set of teeth by using multiple implants. But you can, and some people that are wearing dentures, maybe some of our audience are wearing total dentures, and they can say that, for example, the lower denture is difficult to deal with because the tongue is at the back. When the person is speaking, the denture tends to move because of the muscles that are around the area. Because also the jaw has is not providing enough retention like the top jaw.
Right.
The lower jaw don't have any palate. The tongue is at the back. The tongue is a structure that is moving all the time when we talk, when we speak, okay, when we are eating. So it's difficult to deal with the lower denture. Some people, they don't like to receive total lower dentures. However, by having an area in that lower jaw with a little bit of bone, we can place 2 implants to make those type of dentures more retentive and more easy to wear. The retention by using implants in that type of cases will be done by using clips between the implant and the top part that will be in the denture. We can use clips, and we can use also magnet.
Okay.
So that is an option, another option in which implants are indicated. Okay, so, but not everybody sometimes can receive implants by a short period of time, or maybe the person cannot receive implant because the bone is not enough. So there are certain type of cases in which we will need to identify if the person can receive an implant right away, or maybe the person will need to do some other type of treatments to increase the thickness of the bone. Okay, we will I will show images, the bloody images that we were talking about. So, and also there are some conditions, health conditions that the person is not allowing the person to receive dental implants. So, for example, those type of patients under certain medication, like which the name is are biphosphonates, that those medications are damaging the capacity of the bone to heal in a proper way.
And what medical condition requires that treatment?
That those patients are having biphosphonates are a type of medication that are used at chemotherapy.
In chemotherapy. Okay, great.
Okay, so also people that are under radiotherapy.
Radiotherapy.
Because they are unfortunately having a type of cancer. Okay, any condition that is in which the healing process is compromised will be
the treatment will become ineffective.
Will avoid for a short period of time for those patients to receive this type of treatment, because sometimes after, for example, the patients that are suffering cancer, once the whole treatment is finished, the chemotherapy and so, the patient can go back to the normal life and receive implants. But in the middle of that treatment, you cannot, because the implants, of course, will fail, since the healing process of the body is totally compromised. We need to remember that chemotherapy and radiotherapy are type of treatments that are fighting the cancerous cells, but also are damaging the general cells in our body. Okay, so the cancerous cells are more sensitive because all the machinery inside is damaged by some DNA problems and so, but also the normal cells will be compromised once the body is under this type of treatments. Sometimes also another condition is the anemia. For example, a severe anemia also is compromising the healing process. Okay, some patients are asking me if suffering diabetes or hypertension will be a contraindication for this type of treatment, and the answer is no. What happened with the diabetic people is that we need to control the diabetes. Of course, if you are in the middle of a crisis, when I say crisis, is that your sugar levels are too high and there is no way for you to control that. You need to visit your internal medicine doctor to control those sugar levels, because in the middle of that crisis we cannot perform this type of surgery. Okay? Same thing with the hypertensive patient. The problem with the hypertensive patient is that during the surgery will be a tendency to bleed, since the blood pressure level is high. So if you are in a crisis, we cannot perform this type of situation.
Is it a requirement that when you're going to be doing this level of surgery, that you have some tests and so on done, so that you have a clean bill of health, that you can see that to say, well, because somebody might come and say, no, doc, I all right, me good, but then you need to see for yourself that this patient has all of this.
Yes, to safeguard yourself as a doctor and the life of the patient also, you need to do some tests. And you need to do blood tests, you need to measure the blood pressure. We need to do a very important test, which is a CBCT scan, in order for us to measure and to identify the areas in the mouth in which we can put an implant. Because by doing a CBCT scan is a type of test in which we will see three-dimensionally the disposition of all the bones in which we are planning to set the implants. So because the implants are coming in different sizes depending on the condition of the mouth. So by using the CBCT scan, we will make a plan. We will get to know the bone quality of that patient, and we will get to know the thickness of the bone, and we will make the plan of how many implants use and the size of those implants. Okay, so also, well, I just mentioned that some patients also that the bone is not enough, because when you lose your teeth for a long time, that section of the bone will be going into a resorption, because what you don't use in your body, the body as naturally will go
Expel.
and will reduce that area. Okay, and with the bone is exactly like that. If you lost your teeth in an early stage, your permanent teeth in an early stage, let's go to say most of the molars, because people tend to don't pay attention to the molar area because are at the back.
Yeah.
The frontal teeth are more. People try to keep them because it's the front is what people can see.
Give more care to that.
Exactly. Some people are careless for the molars. And when you lost your molars in an early stage, let's go to say 12 years old, 16 in your 20s, and you reach to your 40s, and you realize that you lost all your molars, and your chewing capacity is not longer there. So basically, you are chewing with your frontal teeth. We need to remember that each sector of teeth has a function. Like, for example, the incisors are made essentially to cut the food, and from the canine to the back are made by to chew our food. So once you don't have molars for a long period of time, and you are willing then to replace them, but you don't want dentures, you want implants because it's more comfortable. And the situation is that once we are going to see that bone after, let's go to say 20 years, 15 years without any replacement there, having the teeth missing, then we discover that the bone level is so down that we are not able to put an implant or any implant, because, for example, the lower jaw, there is a nerve on the lower jaw that we need to be careful, extremely careful with that nerve, because if we damage that nerve, the mentonial nerve, placing an implant, we will create a problem for the patient. The patient will feel a numbness permanently in the lower jaw. Okay, because that nerve is controlling all the sensitivity of the lower jaw. And on the top jaw, we need to be careful with the sinus, because our top jaw is empty inside. We have the sinus, which is a structure that is having some physiological functions in our life. And if you lost your teeth, molars, for a long time, then the thickness of that bone is compromised, because the sinus tend to increase the size, and in that case we will not able to put implants in that area without doing some type of procedures that are more invasive. I am speaking about the sinus lifting in this case, in which we will need to make a little window at the side of one of the wall of the sinus to put bone, to lift the sinus membrane and put bone in that area, increasing the thickness. So after that bone is integrated into the body of the patient, after a waiting time of between 4 to 6 months, then we will be able to put implants, because we increase the thickness of that bone by lifting up the sinus membrane. So in that case, of course, the cost of the implantation will be more high.
Yeah, that's
because
right.
You have to go into a surgical procedure to prepare the area to receive implants later. Okay?
So, if you lose a tooth, whether it's a top molar or bottom molar, and you know that you want to do an implant, how long after taking this tooth out or having the tooth removed you can start the procedures for an implant?
That is a good question, because if you are sure surely losing a tooth, and you're going into your dentist, and your dentist gives you the treatment plan, you can do the implantation right away, immediately after the extraction. So we call that immediate implants.
Okay.
We will do the extraction, and immediately we will place an implant there. These type of cases, also we need to add bone in the area, because what happens is that the shape of the implant will not fit perfectly into
Where the tooth came
the
from.
alveolar socket. Alveolar socket is the space that was occupied by the root, and those empty spaces, we will need to fill up those empty spaces with artificial or natural bone that is going into a process to make that bone to make that bone to make it to use in
Yes,
in
yes.
those cases. So that we call that bone grafting, okay? Because we need to make sure that the implant will be well attached into the bone, okay? Because if the implant is not so well attached, then later on the osseointegration process that I talked about recently will not will not happen, and the body will reject the implant, and the implant can fall. If it's not in an early stage, will fall later on once the crown is in place and the implant is receiving loads. Okay.
One question. You mentioned bone grafting, which is bone grafting. You're taking. I would. I don't know where you're going to be taking the bone from. That sounds like a whole nother procedure by itself. But you also mentioned artificial bones. So artificial bones are you place them there, and what happens? The natural bone grows around that.
The artificial bone is made made of hydroxyapatite, which is the main structure of the bone of our
Okay.
bone. So this hydroxyapatite is made artificially if the bone is artificial, or we can use also natural bone that is coming from animals, bovine bone, and so that after going into a process in which they will remove the protein part of the bone and will leave just the mineral part, and they will granulate that bone, then we can use that bone. And also, we can use the same patient bone. Sometimes the patient has plenty tori. Tori is a formation of bone that I don't know if the audience know about this, that you can check in your mouth, mostly on the lower jaw inside, or also on the top jaw, or even on the palate, and you have this huge bone formation. We can go in there, cut that bone, and prepare that bone, crush the bone, and use the bone in the patient. There are also some other areas. If you need more a huge amount of bone, you can go into the scalp and collect a little bone from there, the waist, which is also you have to go into general anesthesia and so to remove that amount of bone.
Well, here you talking about all these things, but cutting and grafting and so on. Like I feel my whole face start hot when you talking about this thing, because like I feel it, because I'm thinking about all these cutting and so on.
Yeah,
But
uh-huh.
when you're doing all of this, the patient is on anesthesia, and you're doing this. You're competent at what you're doing, so I might be thinking about all this pain and so on. But the patient really they're under the light, and you're doing your thing, and they don't. When you're finished, there's.
I have to say that once of course, if you are talking to a person about, I will go and cut your bone, smash your bone, and put it like this, and the patient is like, I will put a screw in your mouth, is something that is a little bit scary, but I have to say that the process is not painful at all.
Okay.
Plus, usually we indicate some painkillers and some pre-medication before to prevent pain and infection after the procedure is finished. And even sometimes I don't like really to abuse of medications too much, and sometimes even the patient don't need those type of things, because it's like a feels like a normal extraction once you have to place a single implant without going into extraction and bone grafting and so. So the procedure is not painful at all.
And so when the bone becomes thin, let's say on the lower jaw, bone becomes thin, and you have to put an implant. So I want an implant, but I've lost my bottom molar for, it's been 15, 20 years now. So obviously the density of the bone in that area is not what it used to be. It's very thin now. You'll check it out, it's thin. You're gonna put artificial bone in, but are you gonna expand? Explain to me.
We do a procedure that is the expansion of that bone, which means that we will cut right on top of the bone, all the way across, all the way long, and then do some cross cuts. And then expand the bone, because the bone is hard but also is a little bit flexible. We will expand the bone, put on screws there, and fill up those empty spaces with bone graft. Okay, so by doing so, we are expanding the bone, and we will be able to put a set of implants there. That is another type of procedure. That in general, when we have to do this type of extra surgical procedures, we call that advanced implantology, because we are doing something extra to make sure that the patient will be able to receive an implant, and the implant will last long. Okay, because if you don't do bone grafting, sometimes the quality of the bone is not enough to hold the implants, and maybe the implant will not fall during the healing process, but under the pressure of having a crown or even a denture, the implant will become loose, and the body will reject the implant later on.
Wow. And you're doing these surgeries. You have done these surgeries before. Because when I'm listening to you talking about these surgeries, it sounds so high tech. I'm here listening to you and I'm saying, wow, this is actually being done right here in Guyana. You hear that there are types of surgeries that people have to do, maybe not necessarily for dental implants, but other surgeries they have to travel overseas to get things done. And when I'm hearing you, as I'm listening here, you talking about these types of implants, it seems like unreal that it's actually happening right here, and not just happening right here, but with someone who's competent, qualified, certified to do so, and with a track record also, because you've done these things before. Wow, that is amazing. You gotta shake your hand again for this, because you keep amazing me more and more as the show goes on. So I get a full understanding, and I'm sure that the audience out there has an understanding of how implants, what the procedures, and as gory and as gruesome as it sounds, it's not necessarily like that, because you're on anesthesia, you don't know what's happening. As much as you're talking about cutting the bone and splitting it and all of that, they don't know that all of that's happening while you're doing it.
No.
Because it's delicate processes, right?
Exactly. Yes,
right.
Yes. You have to do it with careful and so.
This topic about implants tonight, I don't know if you'll be able to complete this topic, because it's very interesting, but I'm amazed, and I would like to know so much more, because I'm sure everybody who's watching there, we have a lot of people watching us tonight. We have Judy Kayam watching, Kisunde Ramdas, Elizabeth Prasad, Shami Sham, Liz Aladdin, Aliyah Mohammed, Devika Mohabir, Carletta Glasgow, Mike Jailal. Mike Jailal wants to know what's the cost for an implant. Jai, just call the numbers at the bottom tomorrow and we'll tell you. Mamzo, Farzina, Ibrahim, my good buddy friend, we go way back, Rocky Rameshwar, watching all the way from New York. Rocky went, I think Rocky did some procedures sometime back. We'll talk about it. Jean Cornelius, Shelly Mangru, and Leela Singh. Good night to each and every one of you. Thank you for joining us. As you know, this is becoming a favorite program for a lot of people. They're looking forward. People are calling me and said, "Hey, are you guys on Wednesday?" Yeah, we're on. We're always on. We're going to be here for a long time. As a matter of fact, we're going to be here forever. You better get accustomed to us. We're not going anywhere, because the information we're bringing to you. And there's times when we're going to do a little, we're going to do something different. We're going to have kids come in here, show them how to brush their teeth and all of that as the show goes along. But implants, this is a really, as I said, I refer to that as delicate processes, because all of this you cannot afford to go wrong at all. You cannot afford to make a simple mistake when you're doing this. There is no mistake. It has to be done, because you said with the nerve, if you hit that nerve, that person would end up with a permanent numbness in their face for the rest of their life.
Mm-hmm. Yes.
So, as we said the last time, when you're going to a dentist to do anything, it's good to ask them, are you qualified to do this? And where's your certificate? It's your right to do that. Don't feel as if, the dentist is going to feel bad or that. Well, it's better him feel bad and show you his certificate or not, than for you to end up with nerve that a face that that is numb for the rest of your life, or put in bad braces, and then you have your bones going in different directions where they're not supposed. Your face start looking different. You want to know why? Because they're supposed to be pulling in a certain way, braces, and they're going in opposite directions in which they're supposed to be going, and you start like, what's happening to me? And you may end up losing all your teeth. So that's why I'm emphasizing that people really do ask for certificate of competence in these areas, because it can cost you your life. Because when you tell me about cutting this bone and so on, if you're not capable of doing it, or another dentist out there is not capable of doing it, then they could cause some serious damage to somebody who just wants to have a good smile. That's what you do. You went to get a good smile and you end up with like something crazy that you never signed up for. So I'm glad that you're raising all of this with us, because as we advocate all the time, please seek the right medical attention in whatever happens to you.
Exactly. Yes. So before going into showing some cases that have been done in my office, I need to also explain to the audience that the implants need care. You need to have a post care once the implants are in place, after the surgery was done, and also after the crown over or the dentures are put in place, because it's very important to take care of the implants. The implants can get infected if you are not taking care your implants properly. Okay, so we need the support of our patients taking care those implants are crowns that you put over, or dentures over the implants. So usually during the healing process, the patient has to be careful brushing properly, using some medicated mouthwash, which is for example the chlorhexidine is one of them, making sure that will not be any infection around the gum that is healing. Okay, during the healing process, the implants will go and will be sealed under the gum, or maybe a little screw will be showing up over the gum. Okay, so during that healing process, you cannot allow for that little structure that is showing up over the gum to get dental plaque. We need to remember that the dental plaque or biofilm is full of bacteria, and those bacteria will be working, producing some chemicals that will damage the healing process. Okay, and once the crowns or the dentures are in place, then you need to be careful keeping your implants clean, meaning the structures that are over the implants clean, not allowing the dental plaque to remain under the crowns or under the denture for a long time. And what the patients can do, apart from using mouthwash, apart from using the proper toothbrush and toothpaste that we talk about that
a few programs
ago, you can use a water pick. Water pick is a little appliance, not so expensive. You can buy the one that are brand name, or even the one that are not brand name, to make sure that water will flush any dental plaque that is growing under the crowns or under the dentures.
Okay.
Just to making sure of not developing any mucositis. Mucositis is the inflammation of the mucosa around the abutments or around the structure that are holding the dentures. And that mucositis, if you allow that process to continue, will end up in a perimplantitis. Perimplantitis is the inflammation of the structures that are surrounding the screw. Once the bone started to lose, then the implant is under risk, because we need to remember that the implants are structures that are holding
Yes.
teeth or dentures, and those teeth or dentures are chewing. So a lot of loads are going into that screw.
Pressure is being applied there.
Exactly. So once that a huge pressure is being applied in a bone that is inflamed, then it will be for sure the body will reject that screw. Okay, so it's very important for our audience to get to know this. For those members that are thinking to get implants, to have some implants, or those that are already receive the implant treatments. Okay, so after finishing with this, we will see some of the cases that I did. Like for example, this one here.
Let me just
Yes, sir.
let me just say that again, viewer discretion is advised. Some of the images that you're about to see may not be suitable for your eyes, because some of it is very bloody, but it's actual surgeries that were performed by Dr. Pico. So we're not taking images of the internet and all of that. We're taking actual images to show the processes
From my records.
from your records, right?
Yes.
So again, viewer discretion is advised. It's a little gory in some instances, and if you cannot deal with it, then please look away.
Yes. Like for example, this patient here, the patient lost the whole set of incisors. The incisors are the frontal teeth on top, keeping only one, a lateral incisor. And what was done, 2 implants on the right hand side and 1 tooth preparation on the opposite side, as the audience can see here. If this patient don't receive this implant, then to make the bridge, this is how important is this treatment. To make a bridge so long, we will need to file not only the canine but also the bicuspid here, and this canine opposite and the next bicuspid, because as the bridge is getting long, we will need to file down more teeth to make sure that this bridge will stay long.
More support.
Because we will give more support. Okay, so just imagine a bridge. That is why we call this bridge with not enough support. How come the cars that will be driving over will get to pass that bridge? Okay, so that is why this type of treatment help this patient to keep the other teeth around healthy, because this canine still there. There is no damage to the canine, but we use 1 incisor and we place 2 implants here. Okay. To get to do this treatment. The same patient received an implant in a premolar area. What people can see here is the abutment. We call this abutment, and the screw is inside the bone. Okay, so this is the crown once it's in place. After the patient passed the whole osseointegration process, that will take between 4 to 6 months, depending on how healthy the bone of that patient is. This is the bridge, the crowns for the previous image that we saw. So the patient passed from being like this to look like this.
Okay.
Okay, so what we did, two implants here, one natural tooth that we file down. Okay, so we was able to keep the rest of the teeth healthy.
So you have one tooth that is screwed on, and two that is screwed
Two
in.
implants.
Yeah, and the other one
And
is,
this one
is
is
a
a-
cemented.
Is a yes, exactly.
Okay.
Okay. So our next case here, this patient here. This patient here was suffering from a disease that we call periodontitis. Something that we spoke about that once we were speaking about dental plaque and so. This patient ended up losing the bone because the dental plaque damaged the gum, creating gingivitis and later on periodontitis. So which is mean that the bone that is surrounding this area is no longer there, and reason why the tooth started to move. And as we can see, the tooth is down and out of the position because there is not enough bone holding this tooth. So I don't even need to see an X-ray to get to know that there is not enough bone here. So
Because the tooth is.
because the tooth is in this condition. So, but of course, we need to do X-ray
Yes.
and do the CBCT scan. So, but this patient has to go into the bone grafting because will not be enough bone in this area to hold an implant. Okay, so and this is one of the body images that we talk about. Okay, after opening a flap, and as the audience can see here, there is a massive bone loss in this area. So if we're going to put an implant here, we will need to, after removing the tooth, we will need to fill up that empty space with bone. Okay, and what people can see here is better you can see the little screw there inside, and the rest here is bone. How was this is a membrane, a collagen membrane that we need to put over to keep that bone in place, because if you don't use this, that bone particles will be loose
And they fall out.
will be going out of the surgical area if you don't put this in place.
Okay.
Okay, so this is once we stitch back the area after the bone grafting was done, and in here we replace temporary a tooth by using a type of retainer. Okay.
Okay.
So the patient was like this, and the patient ended up temporary waiting for the healing process, that in this case was 6 months, like this. Okay, wearing a retainer with a tooth made in acrylic, of course, for the patient to go out and so
Yeah,
on.
that's
Okay?
like an invisible retainer.
Eh?
It's like an
It's
invisible.
yes.
Okay.
It's clear, as you can see
Yeah,
here,
transparent,
and
yeah.
it's holding a crown here. Okay. So this is another case with a similar condition, a periodontitis. Okay. After the tooth was removed, you can see here how much bone is missing here. It's a hole in there.
Yes.
So if you put a screw there, and if you don't fill up those empty spaces, then the healing process, because we need to remember that the bone is one of the structures that is taking a long time to heal. So that is why when we get a fracture, we need to use a cast for months sometimes. Okay, because the healing process of the bone is taking a little bit long. So we need to replace the screw. This is the screw in place, and all this is the bone grafting. Okay, and here the stitches and a temporary tooth. This is a temporary tooth because it's an anterior tooth. We cannot allow the patient to go out showing a screw. So we need to put a temporary tooth in there, waiting for the healing time. And this is here the screw, and we can see here the bone surrounding the screw. So this is basically the type of work that the patient will get once they request implants, depending on the condition. Okay, some patients will receive an implant right away without all these type of extra surgeries, and some patients will need to go into this process with bone grafting and so to replace back some of their missing teeth.
Wow.
So
That is very impressive. The presentation was awesome. I have a question. My question to you now will be, when you do this, like the person that did that had the incisor out, and you would have had to place this do the bone grafting, and then you stitch it up and so on. How long does it? What's the requirement? How long does it take for that healing process? What's like an overall time?
An average. Okay. When you use bone grafting, you will need to wait, because we are giving to the body artificial bone or maybe natural bone for your own bone cells to grow over and attach that artificial bone and also the implant. So usually we will need to wait around on the process to put over a crown on that implant once the implant is well attached, once the implant is integrated. And that can happen between 4 to 6 months, depending on the condition.
Okay. We have a question here from Nilofar Singh. She says, I'm due for an implant in April in Chicago. What's the cost for tooth implant in Guyana? So, Ms. Singh, Nilofar Singh, we don't give out prices and so on air because it's unethical, right?
Yeah, but it's far away cheaper.
Yeah. Way cheaper. You'll
like
be amazed.
Half of the amount.
So the numbers are running at the bottom of the screen. Call them tomorrow. Call Dr. Pico tomorrow.
Or
and he will
use the WhatsApp.
WhatsApp. You can just WhatsApp that to that number, and he will let you know how that is going. Dr. Pico, is there a age limit for people doing implants? Is there, what is too early and what is too late?
You cannot do implants in children, of course, because the growing process, the bone is expanding. Okay, so we don't do implants on children because of this process. The bone is growing. So in something that is growing, you cannot put on a screw because we'll end up in some other place later on.
Yeah.
Okay. So and the age, there is the people with 60 years old, 70 years old. Once they are healthy, we can put implants.
Okay.
In there. Okay. Once they have a condition, a life expectation, we can put implants.
The reason I'm asking you is because I saw this video with this lady singing at a karaoke or something, and she's singing this really amazing song, and she, you put in a note, and the whole denture fall out.
Yes, that is a chronic denture.
Because I don't know, maybe it's a Whitney Houston song, and she's singing, and then she tried this big note, and the denture fell out.
Yes.
And I'm thinking, well, implants is a good one, because what you're saying also, even if you're wearing dentures, you can have implants that can hold the dentures in place.
Much better, yes.
Yeah, and you can sing with confidence.
You can sing with confidence, yes.
All right. So I just want to say good night to Roy Yard, Bibi Prasad, Ramil Parashram, Hema C. Prasad. Thank you guys for joining us. Hema is laughing because of the lady with the singing and her denture falling out. Dr. Pico, as always, it's a pleasure. Tonight's presentation was amazing. I did not realize that so much go into something like an implant. We think, but we say implant and it sounds like just an implant, but it's highly technical, and it has to be done by the right people. And well, you're the right man. You're the man. So guys, Again, Innovative Dentistry is coming to you with the compliments of Innovative Dental Care. And Innovative Dental Care is located on the railway embankment in Cummings Lodge. Is just 3 buildings off UG Road if you're going in the direction of Mahaika or Industry. It's a gray building on your right hand side when you're going towards Industry. There is a big sign out there, you can't miss the sign.
Exactly.
And you have the numbers on the screen right now. You can call, you can go there. Dr. Pico is, he's making a name for himself because of the work that he's been doing. A very honest man I know, hardworking. And I sent a patient last week to you. He called me and he said he missed you, and I sent him to you, and he called me the next day, and I thought he was calling to tell me he couldn't make it. So I said, did you get through? He said, yes. But what I called to tell you is that, and I'm not telling this to make you feel good. This is an actual testimony that somebody called me to tell me about. He said, what I admire about that man is the level of professionalism that he puts into his craft. And if you continue to do it that way, brother, you have a very far way to go. And it's always a pleasure, and we will do this all over again next week.
Thank you so much.
And if you want to talk more about implants, I'll be happy to facilitate, because I'm enjoying this. It's really a lot to process, and to know that we are good. It's good to know that the Guyanese public are in good hands with someone like you to help take care of this. Again, you don't have to go to Dr. Pico. If you go to any other dental facility, as long as they can do this, just ask them. Make sure they're qualified and competent to do this, and do it. We're not advocating just for you to come to Innovative Dental Care. Go wherever you want. But what we're saying also is that we are competent in doing this. So again, Dr. Pico, thank you for being here tonight. To all our viewers out there, thanks for joining us. And it was an amazing presentation tonight. Let's do this all over again next week. Join us when we come on air at 6:30 next Wednesday with another episode of Innovative Dentistry. Take care. Ciao for now.